4 months down, it's over. The first semester at UPJS here in Kosice, Slovakia is done for me and my colleagues that are studying both dentistry and medicine. So let's get into what I learned in this semester, what I experienced, and what you could do if you choose to come here for your future studies. So for those of you that want a bit of background, I started my dentistry journey back in 2018 when I flew out to Ukraine and started from scratch. And then it wasn't too long after that I realized that that place was an absolute stinker, and I found myself flying out with a couple of friends to Egypt. We studied at Ain Shams University in Cairo, which was a really cool experience, made some great friends, and I've spoken about that before on some previous videos. You can check them out when you have the time. And now most recently, believe it or not, and I'm hoping this is the last stop of all of them, I'm in Slovakia. And the reason why I'm doing that is because if I was to stay in the other countries, when I return back to the UK, I'd have to do some exams, which are notoriously difficult. I'd have to finish those. They take quite some time as well, just to become a dentist. By me switching over to Slovakia, it basically saves me a lot of time and effort, and a lot of money actually, to make sure that I can finish here in an EU country that's fully recognised by the GDC, which is the dental board within the UK, that allows me to practice without taking the exam and just get straight into the work. The only downside to this entire process is the fact that in Egypt, I was actually entering the 4th year. So this academic year would have been my 4th year. Making the transfer over into Slovakia means that I've actually had to peg myself back, and I'm now in the 3rd year, but it's kind of like a split transition year. So I'm doing some subjects from the 3rd year and a lot of subjects from the 4th year. The way that Slovakia works is that they really push a medical curriculum on their dental students. So a lot of my 4th year subjects are actually just what I would deem filler medical subjects like neurology, gynecology, pediatrics, the hospital kind, not the type that you'd find in a dental chair, and so on and so forth. So not really subjects that we're going to use in our typical day-to-day routines as dentists, but still something that we have to do here at this university. So something to keep in mind if you are looking to come abroad and study at UPJS. So the upside to that means that I can get a lot of my 4th year subjects out of the way, and then next year when I officially enter the real 4th year for me, most of my subjects will actually be dental subjects. So I can really hone on my skills as being a clinician, learn everything that I need to as a student moving forward, and that just makes the 4th, 5th and the 6th years that I have to do here a lot more of an easier breeze. It just makes the whole process smoother, there's less of these filler subjects involved, and I can really knuckle down on understanding dentistry as a whole. So when did we start this winter semester? Well, it all began over on September the 18th, if I remember correctly, 2023. As I say, it's been 4 months now, and the exams have just finished for me. I took this semester around 10 different subjects, and at that halfway point, which is the midterm point, we had to take the exams to basically make sure that we had the right level of understanding of each of those subjects, pass that exam, and that allowed you to then carry on to study that subject further, and then take the finals, which have just happened recently now in January. In December, late December, we actually started our exam period. So it really spans from late December to what would be the early point of February. So you get a solid month and a half, 2 months of an exam period to get through all of your exams. You are allowed a total of 3 different tries, separate tries, per subject to pass, and there are different ways in which they will test you and they will examine you on. For example, some subjects will require just a credit test, which could be as simple as what they call a ROGO test. So you're given a tablet, and on the tablet you'll have a bunch of multiple choice questions, maybe 20, maybe 50, and a time limit. You'll be sitting in a lecture hall or a classroom full of students taking the same exam. You just need to pass it, and the pass mark here, is 60%. So long as you're hitting that, you're fine. You've hit the credit test, you've scored what you need to do, and that's it, you're done. Some exams will require you to do a more of a written exam. So we only had one, so propedeutics, which is a dental subject. We were given 20 MCQs. They were multiple choice, meaning that there were more than one answer that could be right. But in most cases, it was just a single answer. And then we had about 2 or 3 questions where it was written, and it was short form. So it was maybe, 1 or 2 words maximum. Nothing too hard at all. In some cases, you'll have to do the credit test first, pass it, and then you'll have a final oral exam. For example, neurology, which I've recently just passed, was a subject where we had to first sit the ROGO MCQs, pass that, and then you were given almost the ticket to go ahead and do the oral exam. And the oral exam for neurology was insanely difficult compared to everything else that we've been doing so far. We had a set of 27 base questions that we had to learn inside and out, and then you get a 20-minute prep time in a classroom with a teacher. With any of those questions they could ask you, you get the 20 minutes, you write down everything on paper, and then you just get interrogated to death. Now bear in mind, we are dental students, so when you have somebody who's essentially a neurosurgeon or a doctor of neurology asking you 1,000,001 questions about something that you don't really have much of an idea on, it does get quite difficult. This one was something to bear in mind for anyone else who's thinking about doing it. There are some subjects that can be super easy. For example, I would say gynecology was one of the most easiest subjects that we had to take because the information was out there for all of us. But then there are other subjects like neurology that really take things a bit too seriously for dental students and just make life hard. So for me, how did the exams go? Thank God they all went very well, quite swimmingly. I achieved some decent results, I would say above average results. I can't remember them off the top of my head, but I would say the upside to this university is the speed at which they give you the results. So we have a platform for students known as the AIS2 platform, whereby you can book your exams, you can pay your tuition fees, you can do pretty much everything on there. But one of the key things about this website is that the exam results come on there very quick as an hour after sitting the exam. So you could do your exam and have the result within an hour, which I think is such a nice benefit in a university like this, because you're not spending days or weeks or months stressing about what your result might be, whether you have to retake, whether you don't. And this is something that I found in Egypt, which was a massive problem. We would sit exams and it would be into the next academic year and you still may not know whether you've had to take a resit or not. There were people that didn't know when their resit period was and they would already be starting the next academic year. So it's super stressful in an environment like that. So UPJS really does help out by giving you your results nice and quick. I think the longest that we waited for a result was a day. Like we would have taken the exam and a day later the result would have come out. So it's nice and slick, very easy to get through. Which brings me to the point of the standard of education. So the standard of education here, in my opinion, is very high. It's very hands-on. There are a lot of different clinical departments in both medicine and dentistry that really allow you to explore the different environments there are in the hospital setting, in the dental chair setting, and of course in the classroom setting. So you can ask 1,000,001 questions to some very well-educated people out there that will help you through the different subject matter that you might have. The education level, I would say, is only second to Egypt out of the experience that I've had. Where in Egypt, it was a constant barrage of information at a super high level, with expectations of students to be also very high. I would say here is more of a realistic approach, but they still have very good teachers and professors, and actually a lot of access to different things as a student that you can do that helps keep your hands busy. Now for dentists out there, that's super important. And of course for those that are looking to do medicine, this is something that you require before you actually enter your foundation years in places like the UK. So I'd give this a massive thumbs up as an awesome university to study at, and something you should definitely consider. However, this brings me to one of the negative points that has just popped up in the last couple of weeks. So our university actually announced that as of next academic year, there will no longer be transfers taken by students if they study from outside the EU, America, Japan, Israel of all places, and a couple other random countries. In some cases, they will look at your file and your circumstances, but I wouldn't bank on it. However, the next best suggestion that I can give for anybody who is trying to get into an EU university is to look at other places in Slovakia. There are other universities that are still accepting students, and their universities are of high standard. There's places like Poland as well, Bulgaria, Romania, and the rest of it that would allow you to have the EU status of a graduate without compromising on having to take further exams when you return to places like the UK. And how have I found it outside of university? Well, we've grown our football group week on week. We are getting so many people added into that group every single week. I think we're now up to about 60 or 70 different people in there at the moment, and we are still playing regularly on a weekly basis. And I made some really good friends at this time, recorded a few videos on GoPro, which I'm sure you've seen on my channel. And it's just been an eye-opening experience to actually be able to spend time with people from so many different countries and learn so much about their backgrounds, what their journeys are, what their stories are, and what they're planning to do in the future. One thing when you speak to all of them is that they are very satisfied with the university at the moment, and that it's giving them the platform they need to help build a successful future in the chosen fields that they've decided to embark on. That's something that I think is shared by all of us. So from an extracurricular point of view, I think we're in a crowd that we all appreciate each other. And for anybody who is looking to come over, you'll fit right at home here. I've also spent time exploring the city, exploring the town. It's not a mind-blowing place. I'm not gonna sugarcoat this and say that, Kosice is full of amazing places. It really isn't. It's a bit of a small town and it can get quite repetitive at times. But the good thing about this city is that it has its own airport. So you can travel anywhere that you like, which is something that El Noam mentioned in an interview I did with him, that it's quite easy to get from country to country, and we are landlocked, meaning that we can go to so many different nations and enjoy the cultures out there for a very cheap price. Okay, so with that all covered, let's get back to university. What do I plan on doing in semester 2? Well, surprisingly, I have fewer subjects this semester, which is great. Not by a lot, but enough to allow me to concentrate a lot more on each of them. The hardest one for me would probably be the Slovak language, which is very important, and it's a prerequisite for all students that study here, no matter what you're studying and no matter what year you're in. You have to pass 4 semesters worth of Slovak language. But I will be able to focus more hours on learning the language, hopefully, as well as, again, focusing more on the subjects that I have without spreading myself too thin. I think the other thing I'll do differently in semester 2 is try to get the study material a little bit earlier and work through it, so that if I do have oral exams, which I think most of them will be by the end of semester 2, that I'm a lot more confident with what I'm saying and the subject matter. That's something that I needed to experience first time round here in semester 1, because I'd never done any of the exams here before. So now that I know a bit more about how it works here in Kosice, I'm quite confident that semester 2 should hopefully go quite well and set me up for the future years. So again, I've mentioned it before, I'd definitely recommend it to anybody out there who's looking to seriously consider studying medicine or dentistry in the EU with a very well recognised degree and wants to take that back home to their home nation. And one thing that I've done is actually added a countdown to my phone, which is showing July 1st, 2027. As it currently stands, it's just over 1,200 days away. That's my countdown for how long I have left until I hopefully can say goodbye to all of this and be seen as a qualified dentist, at least in Slovakia. So something that's keeping me motivated day on day, and I would recommend it for all of you guys. Just go out there, you can find these kind of apps on the App Store or Google Play. Just give yourself a nice countdown, something to motivate you on a daily basis, to know that you've only got X amount of days left, and to make the most of those days as well. Build some skills at the same time, learn something new every day, and just keep applying yourself. Because at the end of the day, this time will come to an end. It can be a struggle. I've been doing this for years now and I feel like I'm getting nowhere. I'm still in the 3rd year technically. And people ask me, at your age, are you not fed up with it? And believe me, I am. But because I can see that end goal and the light at the end of the tunnel, it's that thing that drives me every single day. I'd highly recommend it to anybody else out there as well. Give it a go, keep yourself motivated, and above all else, stay happy. Stay passionate about what you're doing, and you will get there. So, thanks for tuning in, and hopefully I'll see you again on the next one. So take care guys, bye bye.